Hello, everyone. My name is Lauren Caton. I'm a current doctoral student at UNC in the Department of Maternal and Child Health. And today I'll be talking about participatory systems dynamics and implementation science. I completed this project in conjunction with Dr. Nina Sperber. As an introduction, participatory systems dynamics is a group model building tool whereby stakeholders are engaged in the decision-making process. They evaluate levers and factors involved in a outcome of interest and look at how the different levers affect that outcome and design a model together. Implementation science is the contextual factors that impact the uptake of evidence-based practice. So similar to PSD, IS looks at contextual factors. As such, IS could utilize PSD, which is grounded in contextual factors, to account for systems complexity. So this review aimed to look at how is PSD being used in implementation science, quantify how it's being used, describe how this model's use varies in between IS studies, and document which outcomes have been noted in these studies. So for our study, we looked at PubMed and PsycInfo. We first looked at the factors involved in participatory systems dynamics. We used PSD and its synonyms, as well as implementation science and its synonyms, and concatenated those two search terms and resulted in 144 publications. These were assessed for eligibility. That resulted in 144. The primary reasons studies were not included and were excluded were that they were not participatory in nature. So they either did an interview with a stakeholder, or they did the loop and then they got stakeholder feedback later, or they developed the model and got stakeholder feedback later, or they were not PSD formally, they were not implementation science, or they were not a commentary, or they were a commentary or a literature review. So we then screened 73 for full text review. Upon further evaluation, we looked at, we decided to exclude, we had included some synonyms for PSD, such as concept mapping, intervention mapping, model building, and community-based participatory research in our search, but decided to look at a more narrow and well-defined participatory systems dynamics, group model building, and or community-based systems dynamics, but not these other synonyms. So that resulted in 10 articles for study. The majority actually did not reference participatory systems dynamics. Only one study was exclusively PSD. The remaining were looking at systems dynamics with a stakeholder engagement model, group model building, community-based participatory dynamics. And they were also mixed in their use of participatory systems dynamics elements, such as causal loop mapping, causal loop diagramming, stock and flow models. Most of them did reference causal loops. The majority, and fewer referenced stock and flow, feedback loops, and reinforcing or balancing effects. The stakeholders that were engaged in these groups included 21 participants on average. All were either clinicians or researchers, while only 2 cited those with lived experience. That's important to note that none of the clinical studies involved patients, and I will talk a little bit about that in the conclusions as well. It varied between studies. So the study type was usually predominantly implementation with a implementation outcome. So acceptability, adoption, appropriateness, feasibility, fidelity, penetration, or sustainability. Fewer actually were explicitly implementation science or qualitative improvement or translational research. The most common phase within which PSD was being used was preparation and implementation. So preparation being prior to implementation, exploring these dynamics. Once you've decided on your problem scope and what you're going to implement and what the solution is, how does that work in the context that you're in as the preparation stage? The predominant outcome was feasibility, looking at feasibility of the intervention of interest, as in building consensus or using PSD to understand that intervention's feasibility in the context it was used in. So again, a theme here is using PSD prior to implementation and around feasibility. And The conclusions that we got from this review, which we have submitted for publication, were that the majority, so 2/3 of studies, did not reference the full set of elements of the PSD model. That's again when I talked about the different PSD components and causal loops, and it was also varied in their terminology around implementation science. So only 3 studies formally used implementation science terminology as a term. The rest were looking at implementation outcomes. A minority of studies used end users or consumers in their stakeholder groups, and this is important if we're looking at feasibility, for example, or even problem scoping. Again, consumers being patients and those with lived experiences. Really, the real takeaway here is that there could be some synergizing between these two groups. Implementation science and participatory systems dynamics are both in their infancy, so it makes sense that there might be some mixed implementation and fidelity to both fields, but they could be synergized by their contextual determinants and determining factors. For policy decision-making, PSD's ability to simulate external factors could be more nuanced and help develop more targeted policies, as long as we're engaging all the right stakeholders in these decisions. So thanks so much for listening to my poster. Hope you have, if you have questions, please reach out to myself or Nina. We were able to actually go to the Systems Science for Social Impact Summer Institute and learn more about these models as well and how we're going to implement them in the fall and spring with some group model building with clinical decision-making tools. So it was really informative, and thank you so much.